Hello everyone, I am Sakshi Danokar. Today we will discuss about the informed consent in a clinical research. So first question arises in your mind, what is a informed consent? Informed consent is a clinical research is a process that ensure the participants are fully aware of all the aspects of the study before they voluntarily agree to participate in the trial. And the informed consent, the process involves the providing the participant with the adequate information related the treatment and giving them time to ask the question and obtaining their written or verbal consent. So what does informed consent mean in a clinical research? Informed consent is the process in which the healthcare provider or healthcare practitioner or any doctor that educate a patient about the risks, benefit, and the alternative of a given procedure or intervention or the treatment that is given to be the patient. Now we see guys what are the three types of informed consent in a research. There is a three types of informed consent form are present in a research. There is a primary type of informed consent we have covered include written, verbal, electronic and implant consent, and each type serve the specific research context and participant need. So what is the importance of a informed consent form in a clinical research? The informed consent form help to prevent a misunderstanding and lapses in a communication that could lead to you being unhappy with the care that you receive, and they make sure that you understand what to expect, including to changes of a less than optimal outcome. So in that way clinical research, in that way the informed consent form in a clinical research show the importance. For example, we have read and understand the provided information, and I have had the opportunity to ask the question. So we understand that participants is voluntary and that we are free to withdraw at any time. So without giving a reason and without cost, we understand that we will be given a copy of this consent form. Now we see the elements of a informed consent form in the clinical research. There are 7 elements of an informed consent form in a clinical research. The first element of informed consent form in a clinical research is a title of the study. Second one is a name and affiliation of a primary investigator. Third one is the purpose of the study, subject selection criteria, study procedures, potential risks and discomforts, then potential benefits, cost and compensation. These are the 7 elements of a clinical process in an informed consent form. So title of the study, second one is the name and the affiliation of a primary investigator. In this we include if the student is conducting the study, state the student information first. These are obtained in a name and affiliation of the primary investigator. Third one is the purpose of the study. In purpose of a study, describe the general purpose of the study which are get investigated or proceed. Then fourth one is a subject selection criteria. Subject selection criteria describe how the subject were chosen or how the subject were not chosen. Then study procedure. In study procedure, in a chronological order, describe what the subject will be asked to do. For example, an activity, completing a survey, etc. Then describe the total length of a time for participation, how long, how often, how far, etc. If applicable, explain that the investigator will be adopting or videotaping, and if this is optimal. And then sixth one is a potential risks and discomfort. In potential risks and discomfort, describe any potential for physiological, social, or financial risks or a harm to the subject and their probability as a direct result of participation in the research and form a breach of confidentiality. So remember that there is a no such thing as risk-free human subject research. Last one is a potential benefit. In potential benefit, describe any expected benefit to the subject themselves, that is clearly state if the subject will not benefit directly from the study, and describe any expected benefit to society or the science. Cost and compensation. In cost and compensation, in case of cost and compensation, describe any cost to the subject, include time spent, and describe any compensation the subject will be offered as a result of participation in the research. If partial participation will result in a partial compensation. Then future use of a data in working with identifiable data. So explain that the identifiable private information, the identified data may be retained and used for additional or subsequent research. And if this is optional, or the state that the data collected will not be distributed for the future research even with the identifier removed. This is all about the informed consent form. Thank you.